Hello, I'm Dr. Robert LaLouche, a board-certified OBGYN physician with over 30 years of clinical experience. I've been asked by my patients to give some more information about the actual labor process. And I'm trying to keep these videos to around 4 minutes, so there's so much to say. I'm going to break it up into segments. So for today's video, I'm going to talk about vacuum delivery or vacuum extraction. So a vacuum is a suction cup that we can put on the baby's head that helps bring the baby out when there are reasons that we need to help bring it out. So what are some of those reasons? Well, if a woman's been pushing for a while, you might be exhausted and need a little help to bring the baby out. Or we might be approaching the point of time where the risks are starting to get higher because the baby hasn't come out for a while. For example, we start to think about helping you get the baby out after you've been pushing for 3 hours if it's your first baby, or 2 hours if it's a subsequent baby. That doesn't mean it's necessary, but at that time we want to evaluate, well, why isn't it coming out? Is the baby having issues? Is the baby too big to fit? Are you getting exhausted? There's also a time where near the end, the baby's heart rate tracing may be indicating the baby wants to come out or needs to come out sooner than you, while pushing, are able to get it out. The most common reason for this is the cord being pinched, or what's called a nuchal cord. Over the years, I used to say the cord around the neck happened about 1 in 6 deliveries. I've reduced it down to about 1 in 3 deliveries. So it's very, very common for the cord to be around the baby's neck. It doesn't always cause issues, but sometimes it does cause the baby to have heart decelerations called variable decels. And as the baby comes further and lower, sometimes the frequency of that increases. And during that time, the baby you can imagine it as if the baby's holding its breath, even though the baby isn't breathing, but it's not getting as much oxygen. And so if it increases enough, we might need to help you get the baby out faster, okay? I always say to my patients, there are 4 ways I can help you get the baby out faster. One is get you to push better. Another is to use a vacuum. Another is a forceps. Another is a C-section. So we're gonna talk about a vacuum. So all babies have some swelling on their head. It's called a caput. And afterwards, when the baby is born, the pediatricians tell us that they're putting the hat on the baby to keep their head warm, but I really know it's to hide the caput because it makes him look a little funny. It goes away in a day or so, it rounds out the head, but seriously, it's for both. Makes better pictures. When you put a vacuum on, so the caput is swelling, and it's actually bruising that the baby will have from just being squeezed from a tight space for a while. When you put a vacuum on, it can make a ring or an indent or a further bruise or even cuts on the baby's head, but they heal up and they go away in a day or 2. When we are trying to move the baby faster than you can move it, that increases your chance of having a tear vaginally because we're moving things faster than your body does. However, if we really need to get the baby out and we don't use some form of what's called instrument delivery, vacuum or forceps, then you can get a bigger scar, meaning a C-section. So when we do the vacuum, you still need to push. We pull, and sometimes it goes really quick. Sometimes it takes a few tries. And sometimes you can have what's called a pop-off, where the vacuum makes a noise. It goes and pops off. Pretty loud noise, can be kind of jarring. And traditionally, we have only allowed 3 pop-offs, and then we say, okay, it's not working, and that limit has, in many places, been moved to 2 pop-offs. So if the vacuum is popping off, that means it's just not working or coming, and then we start thinking, okay, what's our alternative, which might be a forceps, may not be, depending on your physician's preference or the certain circumstance, or it might be a C-section. So in experienced hands, the vacuum can be quite helpful to reduce the chance of needing a C-section, to give you a great outcome, to bring the baby out when the baby's having some distress, the heart rate's going down, or when you're just simply exhausted and need a little help. So I hope you found this helpful. and look for the other videos about forceps, and we'll talk about pushing techniques and other things for labor. Thank you.